All right, you know that expression that music heals. Well, this next story takes it to a whole new level after a man in South Florida had brain surgery while playing his guitar. CNN's Rahel spoke to the surgeon. Here's some of that conversation.
So let me understand this. You say that the patient being awake, Christian being awake for part of the procedure, created all sorts of benefits. Explain that to us.
So Christian had a difficult, complex tumor. It was located near the part of the brain that controls hand function on his left side. So the ability to take out the tumor while he's awake playing the guitar allows us to monitor his left hand function. So as you're taking out the tumor, you have to be able to know when it's reaching critical structures, and then that's when you stop. So the ability to do it awake, having our comprehensive team, allowed us to be aggressive on Christian rather than leave a lot of tumor behind.
How did that initial conversation go? You found out that he played the guitar professionally, and then you say, all right, great, so bring in your guitar to the OR. I mean, how did that go?
He was game from the very beginning. I spoke to him. I said, look, this tumor is near your hand area. It has to be awake. The most critical part of this procedure is to maintain your hand function. And when he told me he was a guitar player, I said, look, let's get you playing guitar in the OR. And he was incredibly accepting from the beginning. We went over everything in detail. He was a phenomenal patient from the very beginning.
What if he wasn't a musician? Would any other sort of hand movement have worked in this way, do you think?
Yeah, I mean, we do testing on people who are not musicians, of course, and we just test their hand function, either squeezing, moving their fingers 1, 2, and 3, extending their fingers. But when you have the ability to test something so delicate like playing a guitar, it gives you much more fine motor movement. And so the precision of the exam becomes much higher.
How could you be sure? I mean, you think brain surgery, I mean, pain management. I mean, how could you be sure that he wasn't in pain when you had to wake him up?
We have a phenomenal neuroanesthesia team, and I think anyone who asks about these awake craniotomies, that's kind of the take home point, is that the surgeon is one small aspect of an awake craniotomy. The most important part is honestly neuroanesthesia, where you keep the patient awake but comfortable, in no pain. They don't necessarily remember all of the details, and that requires dedicated, specialized neuroanesthesia. So for this case, I had Dr. DeGaulle, who's our director of neuroanesthesia, incredibly experienced with these awake craniotomies, and you can't do these procedures unless you have world-class anesthesia.
How can you share with us how Christian is doing? I mean, is he back playing the guitar? I mean, how's he feeling? How's his recovery going?
He had an amazing recovery. He left the hospital the day after surgery. His hand function is better than it was before the surgery. He's back playing guitar. His pathology is a glioma, which means it's a primary tumor. It's not coming from another part of the body. And he's seeing our specialist here at Sylvester Comprehensive Cancer Center.
That's great. And then what about, I mean, what about other implications of a serious procedure like this while a patient is awake? Can you see this being used, or is this being used for patients who perhaps have other health issues?
I think in general, the literature shows that awake craniotomies, those patients do very well. I think the principle is the less anesthesia that you give a patient, the sooner they're up out of bed, the sooner they go home, the less complications they have. So we have a very low threshold to do awake brain surgery. If a tumor is anywhere near a critical part of the brain, we do it awake. Number one, it makes the surgery safer and it minimizes complications, but it also improves outcomes overall. Patients go home sooner, they feel better, and they wake up quicker.
Yeah, I thought that was fascinating. I read on the website that it actually improves recovery time, which feels a little counterintuitive, but I certainly take your word for it. Really good to have you today. Thanks so much, Dr. Komotar.
No, listen, it's a pleasure to be here. Thanks for your time.